Hello everyone. So in this session we are going to start with the topic of arches of foot, a very important topic, and after covering arches of foot we will continue with the sole of foot, in which I will tell you about the layers of the muscle. So we have got 4 layers of the muscle and individually I will discuss all. So let's start with the first topic, arches of foot. So actually, if we talk about the arches of foot, there is longitudinal and transverse arch. There are two longitudinal arch. One is the medial longitudinal arch and the other is lateral longitudinal arch. Also, there is anterior and posterior transverse arch. So, how it is formed, what are the support system for this arch, and why arch of foot is a very important topic, I will tell you. Actually, there are too many deformities correlated with this topic. So, we will discuss clinical anatomy also. So, what you can see in this image, the red color highlighted line. So, this is showing you the medial longitudinal arch. So, as you can see, it is high arched. If we talk about medial longitudinal arch, it is high arched and it is formed by following bones. So, the important bones, so I just want you to note down. This is the calcaneum bone, which is also called as the heel bone. So, this is the T for talus bone. And we have got the navicular and the cuneiform bones, and we have got the medial 3 metatarsals. Medial 3 metatarsals. So, altogether that means the formation of medial longitudinal arch is from following bones. So, it is formed by the medial aspect of calcaneum bone, the heel bone, the talus bone, the navicular bone, the medial, the 3 cuneiforms, and also by the medial 3 metatarsal bones. So, write on medial longitudinal arch of the foot, bones forming. So, first thing is to know which all bones forms the medial longitudinal arch. The answer is medial longitudinal arch is formed by following bones. And the bones which is taking part in formation of the medial longitudinal arch are following. So, in this category we have got calcaneum bone. So, actually this calcaneum tarsal bone medial aspect, mainly the medial part, the talus bone, the navicular bone, we have got the 3 cuneiform, bones, and the medial 3 metatarsal bone, medial 3 metatarsal bones. So, these are the bones which take part in the formation of medial longitudinal arch. Also in this diagram you can see it is arched. Okay, it is arched. So, actually this arched medial longitudinal arch is important for giving flexibility, and it is very important that that it will not let the medial and lateral plantar nerves to be compressed, and the person who has got a good arch, they are definitely a good marathon runners, and those who have the flat foot, they are not good at walking, running, and their medial and lateral plantar nerve, digital nerves can get compressed. So, let's talk about the important point about the medial longitudinal arch. So, if I talk about medial longitudinal arch, it is also important that we should know exactly the important formation. So, the bones taking part in the formation, what are the pillars and what are the different joints. So, let's talk about the pillars. The next important thing is to know the pillars of medial longitudinal arch. तो अगर हम pillars की बात करें, there is anterior pillar and there is a posterior pillar. There is anterior pillar and there is a posterior pillar, and it is important for us to know that which structure is forming the anterior pillar of medial longitudinal arch and which structure is forming the posterior pillar of medial longitudinal arch. तो अगर हम anterior pillar की बात करें, if I am talking about the anterior pillar, the anterior aspect, so just see this image once again. So, if I am talking about anterior pillar, they are formed by the head of medial 3 metatarsal, and posteriorly it is formed by the medial part of the calcaneum bone. So, that is important. Anterior pillar is formed by the head of medial 3 metatarsals, and posterior pillar is formed by the medial posterior aspect of medial calcaneum, medial aspect of the calcaneum bone, medial aspect of the calcaneum bone. Now, other than that, it is also important. So, we have done with the pillars. Now, we are exactly knowing what are the pillars. We are knowing the important bones which is forming this medial longitudinal arch, which we have already talked about. And other than that, we have to also know about the important joint, and we have to know about the summit of medial longitudinal arch, the superior aspect of medial longitudinal. So all these points are highly important for you. So it is important that you should understand all these points. Okay. So we have already talked about the pillars. Now once again I would like to show you this diagram. I just want to remove these all things because we have already talked about these and I have explained you. The other important point is that so we have talked about this will be the anterior aspect. So this will form the anterior pillar. This will form the posterior pillar. Now other than that, अगर हम summit की बात करें तो summit is formed by the talus bone. So this is what? This is the talus bone, and this talus bone is forming the summit, and it is the most important bone, or you can say this talus bone is called as the keystone of the medial longitudinal arch. Other than that, the main important joint for the medial longitudinal arch is subtalar joint and also the talocalcaneo-navicular joint. So here this is T for talus, this is C for calcaneum, and this is N for navicular. So let's talk about that and write important point. Then we will talk about the factors also. Other than that, I would like everybody to just write few important points about medial longitudinal arch. So you can just here itself, if you want, I will just give you 2 important points about this. So the important points are, first thing is that summit. So if I am talking about the summit of medial longitudinal arch is formed by the level of superior aspect of talus. That means talus is the keystone of medial longitudinal arch, and the most important joint of medial longitudinal arch is the talocalcaneo-navicular joint. Is talocalcaneo-navicular joint and also the subtalar joint. These are the 2 important joints of the medial longitudinal arch. Okay, key joint. Now other than that, I would like to talk about the factors. So for understanding the factors which is maintaining medial longitudinal arch, what I am doing, I am slightly enlarging the image. So when I am enlarging the image, it is quite clear that you are seeing the arch from the medial aspect, which is quite clear in this image. And now we can talk about the factors maintaining. So अगर factors maintaining की बात करें तो bones है, ligaments है, muscles है, muscle के tendons है, aponeurosis है. These are all very important for the factors maintaining medial longitudinal arch. So here I would like to tell about the sling support. Sling support means supporting the medial longitudinal arch from superior aspect. The sling support is given by tibialis posterior muscle. As you can see, this is the tibialis posterior muscle which is grooving here, and it is correlated with the plantar calcaneo-navicular ligament and spring ligament. Other than that, we have got flexor hallucis longus muscle. So अगर हम flexor hallucis longus muscle की बात करें, it is having 3 important function to be performed as a support system. If I talk about, it stretches the arch like a bow, and it is also in this diagram you can see. If I talk about, let me slightly highlight this. So this is flexor hallucis longus muscle, this is tibialis posterior muscle. So if I talk about these two muscles are important for, support, sling support, and you can see the flexor hallucis longus, which is a very important muscle supporting the medial longitudinal arch. As you can see, it is passing beneath the sustentaculum tali. So here you can see this is calcaneum bone. So you can see the flexor hallucis longus muscle is passing below the sustentaculum tali as shown in this image, and it is also supporting the talus as it is traversing from the posterior groove of the talus bone. This is the talus bone. So these are the 3 important function of the sling support given by flexor hallucis longus. Sling support is given by the tendon of 2 muscle, flexor hallucis longus, the most important support system, along with tibialis posterior. Other than that, there is also tie beams which is not letting the separation of medial longitudinal arch important bones and all. So we have got medial part of plantar aponeurosis which is forming the tie beam support. Other than that, we have got the muscles of the sole. So we have got intrinsic muscles of the soles also which is supporting it. So we have got flexor hallucis brevis, we have got abductor hallucis brevis which is all giving the support. So let's talk about factors maintaining medial longitudinal arch. So as I have already talked about the pillars, as I have already talked about the important joint and the summit, now I would like to elaborate more, and you should understand which is the other support system of the arches of foot. So यहाँ पे अगर medial longitudinal arch के support की बात करते हैं तो most important bones. So most important bone which is forming the support is the talus bone. अगर ligament की बात करें, if I am talking about the most important ligament which is forming a support for the medial longitudinal arch, the ligament is plantar calcaneo navicular ligament. Along with it, we have also got that is spring ligament, which is also called spring ligament, or we have got the other interosseous ligaments, which is not letting the separation of the tarsal bone. Other than that, muscles and tendons. The third important support system is the muscles and tendons. So let's talk about the support which is given by muscle, tendons and aponeurosis. So first support which I am talking about is the sling support. तो अगर हम sling support की बात करते हैं तो basic sling support which is given by, the most important sling support is given by flexor hallucis longus and tibialis posterior. So one of the muscle is tibialis posterior, which is acting as a sling support and supporting the arch from above and not letting it collapse, is the tibialis posterior tendon. The other sling support, one more sling support, the other sling support of medial longitudinal arch is given by flexor hallucis longus muscle tendon. When I am using the term flexor hallucis longus muscle tendon, actually this muscle has got, this tendon has got three functions to support the medial longitudinal arch. So I would like to write all these three functions of flexor hallucis longus tendon. So please write down. The first support which it gives is stretches the arch like string of bow, Other support is calcaneum. It also supports the calcaneum bone. So it is also, the flexor hallucis longus is also supporting the calcaneum bone. And the reason is that the flexor hallucis longus tendon is passing below sustentaculum tali. Passing below sustentaculum tali. What is sustentaculum tali? It is a self-like projection of the calcaneum bone. The third is, it is also supporting the talus bone, and it supports the talus bone as its muscle tendon, flexor hallucis longus tendon, grooves the talus bone in the posterior aspect, grooves posterior aspect of the talus bone. So done with this. Now the next support system is the tie beam. So we have talked about the sling support. As you can see, we have definitely talked about the sling support, and the next support which is given by the aponeurosis and the muscles of sole is the acting as a tie beam. So you can just write tie beam. So keeping all the bones and the structures together. So for the tie beam support, we have got following support given by medial part of plantar aponeurosis. Medial part of plantar aponeurosis. The other support is given by the muscles of sole like flexor hallucis brevis and abductor hallucis brevis muscle. This is flexor hallucis brevis muscle. So these are the support for the medial longitudinal arch, which is supporting it as a tie beam. So done with this. Now the next important thing is the lateral longitudinal arch. So अगर हम lateral longitudinal arch की बात करते हैं तो you are seeing the, as you can see, this is less arced. Okay, this is less arced. The lateral longitudinal arch is less arced, and actually the basic function of lateral longitudinal arch is that it is supporting the weight of the body. It is supporting the weight. It is important for the support system. And if we talk about more of the flexibility which is given, the flexibility is given, resilience is given by the medial longitudinal arch, but stability is given by the lateral longitudinal arch. So it is formed by the lateral half of calcaneum, the cuboid, and the lateral two metatarsal bones. Here the lateral part, here posterior pillar is formed by the calcaneum bone, and anterior pillar is formed by the head of lateral two metatarsals. So please write down, lateral longitudinal arch is formed by following bones. Is formed by following bones, and the important bones taking part in the formation of lateral longitudinal arch is lateral part of calcaneum bone, lateral part of calcaneum bone, cuboid bone, and lateral two metatarsals, and lateral two metatarsals. Two metatarsals. Now talking about the pillars, so I would like to talk about the pillars and the important joint of lateral longitudinal. Most important joint, अगर हमने medial longitudinal arch की बात की थी, so that was subtalar joint and the talocalcaneo-navicular joint. अगर हम बात करते हैं lateral longitudinal arch की, तो calcaneo-cuboid joint is the most important joint. और अगर हम pillars की बात करते हैं, तो anterior pillar, the anterior pillar is formed by heads of lateral two metatarsal bone. और अगर हम posterior pillar की बात करते हैं, तो posterior pillar is formed by lateral part of calcaneum bone. Now, the other important point is to know the summit. So, अगर summit की बात करते हैं, तो summit is formed by the superior aspect of the calcaneum bone. Actually, the superior aspect, so it is at the level of, it is formed by the superior aspect of calcaneum bone, and it is at the level of, that means it is at the level of subtalar joint. It is at the level of subtalar joint. So this is the level where the summit of the lateral longitudinal arch lies. And other than that, अगर joint की बात करते हैं, तो most important joint is calcaneo-cuboid joint. Is calcaneo-cuboid joint. But I would like to tell the summit, अगर हम summit और joint की तो बात कर ले, लेकिन keystone की बात करते हैं lateral longitudinal arch में, the keystone is the cuboid bone. So if I am talking about the keystone of lateral longitudinal arch, the keystone of lateral longitudinal arch is the cuboid bone, most important bone. Now here again I would like to elaborate about the support system of lateral longitudinal arch. So यहाँ पे भी similar point होगा support system के लिए. We will talk about the bones, we will talk about the ligaments, we will talk about the muscle, tendons and aponeurosis. So the important sling support, as you can see, is given by the tendon of peroneus longus and peroneus brevis muscle. If I just enlarge this, so you can see here in this diagram, these two tendon of peroneus longus and tendon of peroneus brevis you can see, and you can see that the tendon of peroneus longus muscle is arching from the lateral side, grooving the cuboid bone and ultimately attaches to the first metatarsal and the adjoining cuneiform bone. The tendon of peroneus brevis muscle, as you can see, muscle tendon, as you can see, it is also supporting it, and it is attached to the fifth metatarsal bone. So these are the two sling support given for the lateral longitudinal arch. If I talk about the ligament supporting it, is the short and the long plantar ligament as shown in the diagram. Other than that, अगर हम इसकी tie beam support की बात करते हैं, तो that is basically given by the lateral part of plantar aponeurosis. It is given by the flexor digiti minimi muscle, abductor digiti minimi muscle, and also the medial part of flexor digitorum brevis muscle. So here lateral part, sorry, it is by the lateral part of flexor digitorum brevis muscle.